told that you are having a miscarriage is devastating and can leave you and your partner questioning why it's happened to you. Around the world, there is an estimated 23 million miscarriages every year. Yet there is still a lot that we still don't know about them and why they happen. Statistics suggest that 1 in 4 pregnancies end in miscarriage, but this can often feel like an underestimation because nothing seems to bring women together like disclosing a pregnancy loss. You quickly realise that so many people around you have sadly been through it too, often in silence. Knowing that it's common doesn't necessarily help, but at least it can help to make you feel less alone. I'm Brooke, I'm an obstetrics and gynecology doctor, and I'm here to explain what will happen next after you've been diagnosed with a miscarriage and what management options you might be offered. First up, what is a miscarriage? Well, a miscarriage is the loss of your pregnancy during the first 24 weeks. Sometimes when a miscarriage happens, it can be classified further into an early miscarriage, which means that it happens during the first 3 months, a late miscarriage, which happens between 12 and 24 weeks, also known as the second trimester. A recurrent miscarriage is the loss of 3 or more consecutive pregnancies before 24 weeks, and this affects approximately 1 to 2% of couples. When your miscarriage is first diagnosed, it may come as a shock, or it might be something that you've already suspected for a while. For some people, their first wish is to get the process of managing the miscarriage underway. Others, they might need some time to process the loss before even thinking about the next steps. If you've had a missed miscarriage, also known as an incomplete miscarriage, doctors will need to make sure that the remains of your baby in your pregnancy don't stay in your womb. This is sometimes called the management of miscarriage. The doctor or the nurse will explain to you a few options that are available. Managing a miscarriage is crucial to prevent complications such as infection or excessive bleeding. It can also provide you with some emotional closure and to alleviate any physical symptoms that you have, like pain. By ensuring that your uterus is empty, it can prepare the body for future pregnancy. Now, if there's no pregnancy tissue left in the womb, this is known as a complete miscarriage, so no treatment is required. However, if there is some tissue still in the womb, your options would be, firstly, expectant management, where you wait for the tissue to pass out of your womb naturally. The second is medical management. You take medication that causes that tissue, your pregnancy, your baby, to pass out of your womb. And the third option is surgical management, where it is removed surgically. Now, the risk of complications is very small with all of these options, and it's important that you can discuss which one is right for you in your specific circumstances. First up, expectant management. So if you have a miscarriage in your first trimester, you might choose to wait between 7 and 14 days after that miscarriage is first diagnosed to see if the process begins naturally. And this is called expectant management. If you've had some pain and bleeding and then it's lessened or stopped completely during this time, this usually means that the miscarriage has completed, it's finished. You should be advised to take a home pregnancy test after about 3 weeks. If that test still comes up positive, so it still suggests that you're pregnant, you should contact a healthcare professional because you might need some further tests. If your pain and bleeding hasn't begun within 7 to 14 days, or you are continuing or it's getting worse, this could mean that the miscarriage has not begun or it's not completed. In this case, you should be offered another scan. After your next scan, you might decide either to continue waiting for the miscarriage to occur naturally, or you'd like to have some medication treatment or the surgery. If you choose to continue to wait, your healthcare professionals should then check your condition and check in again around another 14 days later. You should contact the hospital immediately if the bleeding becomes particularly heavy or you develop a high temperature, so fever, or you experience some severe pain. Next up, medical management. So you might choose to have medicine to help to encourage that pregnancy tissue to pass if you do not want to wait or if it doesn't begin naturally within the 2 weeks. So this involves taking tablets that cause the cervix to open and allows that pregnancy tissue to pass out. In most cases, you'll be offered tablets, which are called pessaries, that are inserted directly into your vagina, where they dissolve. In cases, you might also be offered an oral tablet first. Tablets usually begin to work within a few hours. You'll experience symptoms similar to a heavy period, such as cramping or heavy vaginal bleeding. You might also experience vaginal bleeding for up to 3 weeks. In most units, you'll be sent home for the miscarriage to complete. This is safe. You should ring your hospital if the bleeding becomes very heavy. You might want to have someone with you, and you should avoid driving yourself home if possible if you already have taken the medication whilst you're there. Sometimes you might be given it to take at home. You should be advised to take a home pregnancy test 3 weeks after you take the medication. If that test is positive, then you should contact a healthcare professional because you might need some further tests. You should also contact your healthcare professional if your pregnancy test is negative but you're still having severe bleeding or other symptoms such as pelvic pain or a high temperature after 3 weeks. It's also possible that you take that medication and the process doesn't begin. So if you don't begin to have any bleeding, then again you should contact your healthcare professional if nothing has happened within 48 hours of taking that medication. Finally, surgical management. In some cases, surgery is used to remove any remaining pregnancy tissue or the pregnancy sac itself. You might be advised to have immediate surgical management if you experience continuous heavy bleeding that cannot be stopped. There's evidence from the pregnancy tissue that it has become infected, or if you've tried the expectant and medical management, they've not been successful. Now, although we call it a surgical management, it actually is just involving a suction device to remove that tissue from the wound. And usually there are no cuts in your abdomen or in your vagina if the procedure is uncomplicated. You'll often be offered a choice of general anaesthetic or having the suction procedure under local anaesthetic if it's available. If you have the procedure done under local anaesthetic, it's often called an MVA, a manual vacuum aspiration. What happens next? Having the surgical management has some benefits. For example, it's usually a complete resolution from the beginning. So you know that tissue has been visualized, and often an ultrasound scan will also be used to help the team to know exactly where the pregnancy tissue is in the womb. And you would hope that usually after having that procedure, you don't need to go on and have anything else. So for example, if you just want to get on and try again to conceive, if you want the process to be completed for your mental health as soon as possible, if you're planning to travel or go away, it can be a more convenient option because you can select the time frame. However, it's still not a guarantee, and sometimes people need more than one surgical management of miscarriage, so they need to go for that procedure more than once. Or sometimes, even though the procedure is successful, you might still develop, for example, an infection afterwards. It's also important to know, as with any surgical procedures, there's risks and complications that can happen. For example, you can get an infection or excessive bleeding after the procedure. It's also possible to perforate the womb, which means that the instruments that are used for the suction of the womb may accidentally make a hole through the womb. That's called a perforation. These types of complications should be discussed with you by your healthcare team, and you should only go ahead if you feel comfortable to do so. Usually, if you do have the surgical management of miscarriage, you can go home the same day, unless you have lost a lot of blood or you developed an infection, in which case you sometimes might be recommended to stay in hospital overnight for observation. But it's a quick procedure, it takes about 10 to 15 minutes usually, and your recovery again should be quick. You should be back up on your feet the same day. But of course, from an emotional point of view, you might be likely to need longer to recover. What happens after a miscarriage? Well, a miscarriage can of course be very upsetting, and you and your partner might need some counselling, or you might need some support. There's a lot of great charities out there, like the Miscarriage Association. You may also have questions about trying for another baby and what will happen to the miscarried baby. Usually, after you have medical or surgical management of miscarriage, the pregnancy tissue is then sent to the lab. Now, unfortunately, this is not actually able to tell you the cause of why you had the miscarriage. They look at the tissue under the microscope, but the purpose is to confirm that tissue was normal pregnancy tissue, rather than it showing signs of something called a molar pregnancy. After the lab have completed their tests, you'll then have the option of deciding what happens next. Now, the hospital might arrange a sensitive burial or a cremation of the remains of your pregnancy, or sometimes they might also offer you the opportunity to arrange your own private burial or cremation. And you can speak to your nurse or midwife or doctor specifically about your option. If your pregnancy ends before 24 weeks and you're in the UK, you don't need to formally register that you've had a miscarriage. In some cases, you can get a certificate in memory of your baby if you want one. Sometimes the emotional impact is felt immediately after the miscarriage, whereas in other cases it can take several weeks. It's common to feel tired, to lose your appetite and have difficulty sleeping after a miscarriage. You might also feel a sense of guilt, shock, sadness, anger, sometimes at your partner, sometimes at friends or family members who've had successful pregnancies. Different people grieve in different ways, and some people come to terms with their grief after a few weeks of having a miscarriage and start planning for the next pregnancy. But for others, the thought of planning another pregnancy is too traumatic, at least in the short term. If you're in a relationship, it can help to make sure that you're both open about how you're feeling, and your partner, of course, may also be affected by the loss. So wondering when it's safe to try again to have a pregnancy after a miscarriage, the usual recommendation is for you to wait at least until after your next period. The natural question is, when can we have sex again after having a miscarriage? Well, you should avoid having sex until all of your miscarriage symptoms have gone. We'd expect your periods to return within about 4 to 8 weeks of having a miscarriage, although it can take some time to settle into a regular cycle. If you don't want to get pregnant, you should use contraception immediately. But if you do want to get pregnant again, you might want to discuss it with your GP or your hospital team. Make sure that you're feeling physically and emotionally well. The advice is usually to wait until after your next period before trying again to ensure your womb is empty and that there is a fresh lining, so that reduces the risk of infection. It also helps with dating your next pregnancy. So if you have recently been diagnosed with a miscarriage and you've got any other questions that I haven't answered, please leave them below and I can create some more videos that might also help some other people.